Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. Today, we have Christine DiNoia again with us. Christine is a registered nurse and an advisor on our clinical transformation team here at Lightbeam. You might have heard her on our last podcast. That was our first one together, and it was a ton of fun. So September is an important month as it marks both prostate and ovarian cancer awareness month. More than just spreading awareness about these two forms of cancer, it is the responsibility of the providers and care teams to ensure that patients come in for timely screenings, that they can determine early diagnoses, and impact improved outcomes. So I was going to interview Christine today to kind of talk about getting those patients in for early screenings to prevent later stage cancer diagnosis.
Well, hi, Laurel. Thanks for having me back again. Yes, the last one was tons of fun, so we'll see what we can come up with for today.
Great. First, I'd like to ask you, just to kick it all off, is why is it so important to get patients into their doctor's offices for cancer screenings?
Sure. So because certain tests can actually help to identify specific cancers before we even have any signs or symptoms. And we all know that early detection and faster treatment has improved outcomes. So we want to identify cancer early so that we have the best survival rates, because we know that they drop dramatically with increased stages. So also when you're with your provider, it's an important time to discuss how we can do better at preventing cancer, understanding the specific cancer risks and your family's cancer history. So for me, I'm sad to admit that I'm over the age of 50. So I have had my first colonoscopy and they did find a few precancerous polyps. So I'm grateful that the screening that I was able to have the screening and that they did find those polyps and they were removed before they became cancerous. I'm a perfect example of why those screenings are so important.
Yeah, absolutely. So what are some questions you think that patients should ask themselves to determine if they should be screened?
Sure. Well, all of those items should really be discussed with their provider. But some of the things that are used to determine who is recommended for a specific screening is generally gender, age, race, and ethnicity as well, family history, and other risks. And what I mean by other risks are things like smoking history, sun exposure, diet, previous cancer diagnosis, those kind of things. And those items are helpful to share with the provider so that they can make an accurate recommendation and order the appropriate screening tests.
Absolutely. So for people who don't know their family history, is there a way for them to find out, what screenings they should be looking for?
Sure, there's a couple of different things that we can do now with the technological advances. And like you said, research does suggest that approximately 10% of cancers have some sort of genetic predisposition. So knowing that family history is certainly helpful, but if it's unavailable, there are some genetic markers for some cancers. For example, the BRCA gene mutations can be indicative of breast or ovarian cancers or can lead to breast or ovarian cancers. And so therefore, in absence of family history, your provider may recommend genetic counseling so that a genetic counselor could recommend specific genetic testing. Also, there are several companies that will do DNA testing to give you insight into your genealogy and ethnicity, as well as personalized health reports. We're so lucky to have this technology available to us now to the general public if needed or wanted. Several years ago, we just didn't have this ability. So you see those commercials all the time for Ancestry.com and I think it's 23andMe, those kind of things. So there's definitely options out there and they're expanding what they test for all the time.
Yeah, absolutely. So what would you say are the first steps that a care team should take to begin that initiative around increasing their cancer screenings in their patient population?
Well, there are lots of national initiatives in the U.S. around particular cancer screenings, and there are tons of resources for care teams to follow along with. So you might find a a national initiative or a campaign going on, and you could follow those steps. And some of those even include television, radio, and print public service announcements that are available that could be used at no cost for organizations and if they want to share them with local media. And you can find a list of those current national education campaigns on the CDC website, but likely there are also local initiatives and resources to help as well. Lots of local hospitals will have campaigns and tend to do this, so definitely I would recommend to do some research in the local area to find out if there are any local initiatives going on, and then you could kind of tag team with those. But here at Lightbeam, we are here to help with identification of groups of patients that are eligible for a particular screening as well. So what we would suggest is that you take, that the care team identify the initiative, the particular basically type of cancer screening that you wanted to perform, and then think about any of the easily identifiable traits, for example, age or gender. And then we can help with building a cohort that would identify those patients that are eligible and have not already had that particular screening within the appropriate time frame. And then we could support in reaching out to those patients either by a written campaign that could be mailed, emailed, or texted to those patients, or we could assist reaching them by phone to let them know it's time for their specific screening. And sometimes patients don't even know that it's time for a screening or that they're even eligible. So it's super helpful to just send out those little reminders either by text or email, mail, phone, whatever, and getting them into the office to get those screenings ordered. Also, if they're, once you get them into the office, having supporting educational handouts in the offices is also super helpful because it helps answer the many questions that people have, and it also can quell some fears. Some people have some real fears around the testing, what it's going to entail, how long it's going to take, is it going to hurt, those kind of things. So it's super helpful to have lots of educational materials available. And a lot of those handouts are readily available on the CDC website. Again, also cancer.net has quite a few, and usually they're free or nominal charges. So, and those are just a couple of examples.
So I know there are a few different doctors that can do the preventative screenings. What would you say is the primary care provider's role in making sure that their patients are covered?
So the role of the primary care provider really does kind of keep all of these screenings kind of in check. So they keep a running record of where they are with all of them. They may or may not be able to perform some of them. For example, most primary care providers can perform cervical cancer screenings, which would be a pap smear, or potentially some primary care providers might be able to do a skin cancer check if they have advanced training. But the primary care provider should be keeping track of all of the preventative screenings that are applicable for a particular patient. And they could either perform them or help facilitate getting a referral to the appropriate specialist if they need a specialist intervention. So the most common ones are skin cancer screening, which can be done by a dermatologist or a primary care provider if they had advanced training, as well as breast cancer, which is done by mammography, as well as cervical cancer, which is done by the pap test, and colorectal cancer, which is done, actually can be done multiple different ways. You could have colonoscopy, sigmoidoscopy, DNA testing. There's multiple options depending on your risk category and your age. Lung cancer can be done by a low-dose CAT scan. And the last most common preventative screening would be prostate cancer screening, which could be done either by digital rectal examination or PSA, depending on the risk category of the patient. So those are the top screenings, and those are the ones that your primary care providers will generally be keeping an eye on to see which ones you qualify for based on your age, your gender, your ethnicity, that kind of thing, and at what age ranges you fall into the eligibility.
Well, thank you for talking through all of these today. We will have a blog post that goes along with this podcast that will have a little bit more detail So be sure to tune into that. You can find it on our website. I know Christine mentioned a few different resources, so we're going to make sure to leave those in the description box below this video. Is there anything else, Christine, resource-wise, that we should let our listeners know about?
So yeah, there's multiple different resources available out there. In additional to the CDC and the cancer.net, there's definitely other resources, multiple other resources. And so there is cancer.gov, which is basically the NIH and the National Cancer Institute, but there are certainly other resources as well. And we'll include a couple of other ones within our description section. And I just would also encourage the listener to also definitely research the local resources, because in general, there are multiple local resources as well.
Thank you, Christine. For anyone who wants to know about our next podcast, we will be talking about health literacy, as it is National Health Literacy Month. So stay tuned for when that comes out in October. And just thank you again, Christine. I really appreciate you joining us today, and you provided a lot of good information on cancer screenings.